Hey everyone, and welcome back to the channel. Today, we're tackling a topic that affects every single one of us, whether you're a pro athlete, a weekend warrior, or just someone trying to stay active. Injuries. They're frustrating, painful, and can totally derail your progress. But what if I told you that many injuries are preventable? And when they do happen, you can significantly speed up your recovery. In this video, we go in to dive deep into the best strategies for both preventing injuries and bouncing back faster when they occur. Let's get started. First up, prevention, because the best injury is the one that never happens. It all starts with a proper warm-up. I know, we've all been tempted to skip it, but warming up is non-negotiable. It literally warms up your muscles, increases blood flow, and gets your nervous system ready for action. A good warm-up should last about 5 to 10 minutes and include dynamic stretches. Think leg swings, arm circles, and torso twists, not static holds. These movements mimic the activities you're about to perform, preparing your body for the demands ahead and drastically reducing your risk of strains and tears. Next, let's talk about progressive overload. This is a fundamental principle of fitness, but it's also a major culprit for injuries when done wrong. Progressive overload means gradually increasing the stress on your body over time to get stronger. The key word here is gradually. Too much, too soon is a recipe for disaster. Whether you're lifting weights, running, or cycling, make sure you're increasing your intensity, volume, or frequency by no more than about 10% per week. This gives your muscles, tendons, and ligaments time to adapt and strengthen rather than breaking down under excessive load. Listen to your body if something feels off. It's better to back off for a day than to be forced out for a month. Another huge piece of the prevention puzzle is form and technique. Poor form is like driving a car with misaligned wheels. Sooner or later, something's going to give. Every exercise has an optimal way to be performed that maximizes effectiveness and minimizes stress on your joints. If you're new to an exercise, or even if you've been doing it for years, it's worth investing time to learn the correct technique. Watch tutorials from certified professionals, record yourself to check your form, or even consider hiring a coach for a few sessions. Getting your form right on foundational movements like squats, deadlifts, and overhead presses will build a strong, resilient base that protects you from injury for years to come. Alright, let's also discuss the importance of rest and recovery. This is where the magic really happens. Your body doesn't get stronger during your workout. It gets stronger during the recovery period afterward. Overtraining is a real thing, and it's a major cause of injuries. It occurs when you don't give your body enough time to repair itself between sessions. So, how do you recover effectively? Sleep is number one. Aim for 7 to 9 hours of quality sleep per night. This is when your body releases growth hormone and performs most of its repair work. Also, make sure to schedule rest days into your routine. A rest day doesn't mean you have to be a couch potato. It can be an active recovery day with light activities like walking or stretching. Now, what happens when an injury does strike despite your best efforts? The first 24 to 72 hours are crucial. You've probably heard of the RICE method: rest, ice, compression, and elevation. While this has been the standard for decades, the current thinking is evolving a bit. The new acronym you should know is peace and love. For the first few days, you focus on peace. Protect, elevate, avoid compress, and educate. Protection means unloading the injured area. Elevation helps reduce swelling. Avoiding anti-inflammatories like ibuprofen is a newer concept. Some inflammation is actually a necessary part of the healing process. Compression can help with swelling, and education means learning about your injury and creating a realistic recovery plan. After the initial peace phase, it's time for love, load, optimism, vascularization, and exercise. Load means you need to start gradually and gently loading the injured tissue. Complete rest is often counterproductive. Movement encourages healing. Optimism is huger. Mindset plays a powerful role in recovery. A positive outlook can genuinely help you heal faster. Vascularization means getting blood flowing to the area, which you can do through pain-free cardiovascular exercise. And finally, exercise. This involves targeted rehab exercises to regain strength, mobility, and function in the injured area. This is where a physical therapist is your best friend. They can design a specific program tailored to your injury and goals. Let's dive deeper into the active recovery part. The goal is to move the injured area as soon as you can without causing significant pain. This is called mekonothoropaiosin. Movement to stimulate tissue repair. For example, if you have a mild ankle sprain, after the initial acute phase, you might start with simple ankle circles and then progress to calf raises and balance exercises. This gentle stress tells your body to send resources to the area and lay down new, strong tissue. It prevents the joint from getting stiff and the surrounding muscles from weakening, which is a common side effect of prolonged immobilization. The key is to find that sweet spot between doing too much and not doing enough. A little discomfort might be okay, but sharp pain is a signal to stop. Nutrition also plays a vital role in how quickly you recover. Your body needs the right building blocks to repair damaged tissue. Protein is paramount. It's essential for rebuilding muscle fibers and collagen. Aim for a slightly higher protein intake when you're injured. Foods rich in omega-3 fatty acids like salmon and walnuts can help manage the inflammatory response. Vitamin C is crucial for collagen synthesis. So, load up on citrus fruits, bell peppers, and broccoli. Zinc, found in nuts, seeds, and meat, is also important for tissue repair. And don't forget to stay hydrated. Water is essential for transporting nutrients to the cells that need them most. Eating a clean, nutrient-dense diet can make a noticeable difference in your recovery timeline. Finally, let's touch on the mental side of injury recovery. It's completely normal to feel frustrated, angry, or even depressed when you're sidelined. Acknowledge these feelings, but don't let them consume you. Stay connected to your sport or activity in other ways. Maybe you can't play, but you can watch games, study strategy, or mentor younger athletes. Focus on what you can do, not what you can't. This might be a great opportunity to work on other areas of fitness. If you have a lower body injury, you can focus on upper body strength. If your arm is injured, you can work on core stability and leg strength. Setting small, Achievable goals throughout your rehab process will help you stay motivated and see progress, which is crucial for maintaining a positive mindset. Remember that recovery is a marathon, not a sprint. Be patient and kind to yourself. So there you have it, a comprehensive guide to preventing injuries and speeding up your recovery when they happen. To recap, prioritize your warm-ups, use progressive overload wisely, perfect your form, and never skip on rest. If you do get injured, remember peace and love. Start gentle movement as soon as it's safe. Fuel your body with the right nutrients and keep a positive mindset. Following these principles will not only make you a more resilient athlete, but will also keep you in the game for the long haul. Thanks so much for watching. If you found this video helpful, please hit that like button and don't forget to subscribe for more content on how to train smarter and live healthier. Drop a comment below and let me know your own best tips for injury prevention or recovery. Stay safe, stay strong, and I'll see you in the next one.